Hey, welcome to The Explainer. When a child needs therapy, it's so easy to think that more is always better, right? More sessions, more hours, just pile it on. But is that actually true? Today, we're going to dig into the science of what really makes therapy effective. And we're starting at the most critical moment imaginable, the very first few days of a high-risk infant's life. Let's get into it.
So to really wrap our heads around this big picture, we've got to start small. Incredibly small. And it all starts with this one simple question. What happens when a baby arrives just a little too soon, before they're really ready to take on the world? And that question brings us right into the world of what we call high-risk infants. Their journey right from the first breath is just packed with unique challenges that need immediate, super specialized care. Okay, so what do we actually mean by high-risk infant? Well, the official definition talks about a high vulnerability to mortality and morbidity. That's a clinical way of saying they have a much greater risk for both life-threatening problems and for long-term health complications right from birth. We're talking about an incredibly fragile start to life, where literally every single moment counts.
And doctors classify these risks in a couple of main ways. You've got premature, which is all about timing, being born at or before 37 weeks. Then there's low birth weight, which is all about size, weighing less than 2,500 grams, or about 5.5 pounds. And as you can see, these categories can get even more specific, like extremely premature or extremely low birth weight. And that signals even bigger challenges for both the baby and the whole medical team.
So why is all this so critical right at the beginning? Well, it's because those first few years are a time of just explosive brain development. It's a concept called neuroplasticity. The best way to think about it, imagine the brain is like wet clay. It's incredibly adaptable, it's moldable, and it's forming new connections at this absolutely mind-blowing speed. And that window of opportunity is exactly why early intervention is so incredibly powerful. You're not just helping, you are literally helping to shape the brain's fundamental architecture.
So who are the helpers during this unbelievably fragile start? Well, that brings us to the crucial, critical role of physiotherapy. Right there in the NICU, that's the neonatal intensive care unit, a team of highly specialized physiotherapists gets to work immediately. And their job, it goes way beyond just helping with muscles. They're looking at sensory motor development, and they even help support the very foundations for things like thinking and language. It is a super demanding field that requires some serious, intense training to help these tiny patients get the best start possible. But how do they even know where to begin? A therapist's first job is basically to be a detective. They have to decode what a baby's tiny movements are actually telling them. And, believe it or not, the way they do this has changed a lot. Okay, so the old way of doing things was called the reflex model. It was pretty much a checklist. Does this reflex show up? Does that one go away on time? But the modern approach, the general movement model, is a total game changer. It's way more predictive. Instead of just checking boxes, therapists now look at the quality of a baby's natural, spontaneous movements. Are they kind of flowing and complex, or are they stiff and repetitive? And this is so important because this new way can help predict long-term outcomes, like cerebral palsy, way earlier than before. All right, so we've seen the kind of amazing expert care these tiny infants get. But all of this leads us to a much bigger question, a question that honestly applies to all kinds of therapy. And here it is. This is really the question at the heart of our whole explainer today. We know therapy helps. We know intervention works, but is just piling on more and more sessions always the right answer? Is more truly better? To get the answer, we're going to zoom out now, away from the NICU for a minute, because it turns out researchers in other fields, like speech therapy, have been studying this exact question, and they have a scientific framework for it. They call it the science of the therapy dose.
And it all breaks down into these three key ideas. First, you've got frequency. That's the one we all think about, right? How often you have a session. 2 times a week, 3 times a week. But the other two, these are the real game changers. Dose is the total number of learning chances you get inside one session, and density is how many of those chances are packed into each minute. This is so important because it tells us that a 30-minute session isn't just a 30-minute session. Its power depends completely on how it's designed. So what does this look like in the real world? Well, there was this one fascinating study on how kids learn new words. Researchers wanted to find the sweet spot, the magic number of times a child needed to hear or practice a new word to really lock it in. And they found it. The number? It was 36. But here's the really interesting part, the kicker. After those 36 exposures, they hit what's called a point of diminishing returns. Basically, adding more practice after that, a 37th time, a 40th time, it gave them almost no extra benefit. This is powerful, powerful proof that more isn't always better. The real key isn't just hitting a total number, it's about how you get there.
And this is where that idea of density becomes so crystal clear. Look at this. In the exact same 30-minute session, a therapist could create a low-density experience with maybe 20 practice trials. Or they could design a really high-density one with 90 trials. Now, of course, higher density can lead to faster progress, but it's also a lot more tiring, more demanding for the child. It's a constant balancing act that a good therapist manages minute by minute.
Which brings us all the way back around to our big takeaway, the thing that ties this all together, making every single minute count. So let's connect the dots. Let's bring it back to that tiny baby in the NICU. This science of dose and density, it's not just for learning vocabulary words. It's a universal principle. The real secret to helping that high-risk infant thrive isn't just about the number of hours a therapist spends with them. It's all about the quality, the intensity, the density of the help that's packed into every single one of those minutes. There's a quote from one of the sources that just sums this up perfectly. Effective therapy is not just about how many times a week, but also what happens in every minute. See? It's not just about frequency. It's about the dose and the density.
And so that leaves us with one last thought to chew on. This whole principle that real effectiveness comes from smart, focused, dense practice, not just from grinding out more hours. That's a really powerful idea. So I'll leave you with this question. Where else in your life, in your work, in your learning, could you apply this idea of working smarter, not just more? Thanks for joining us on The Explainer.